All right, this is going to be a patient assessment for trauma. Apologies if this video seems not put together so well, as I'm going to be going off of all of the mnemonics that were included here for trauma. To start off, I'm an EMT that's responding to a 911 call for a 68-year-old male who fell and hit his head. The dispatch informs me that the patient is conscious but confused. Okay. Upon arrival, I find that the patient is sitting on the floor in his kitchen, leaning against the counter, and there's a small, pool of blood. All right, okay. And I'm gonna try my best, as we haven't just yet done trauma. So, now, for the patient presentation, the patient is awake, disoriented, and slurring his words. All right, we have to get to it. I'm verbalizing that the scene is safe. I'm verbalizing that I have my appropriate PPE on. Okay. The nature of his injury or illness is that it's bad. He's slurring his words. He just hit his head. There's blood on the ground. We have to get this taken care of as soon as possible. There's only one patient. I'm going to go ahead and request additional EMS assistance. Consider the stabilization of his spine if I determine that he has any other traumas to his body besides his head. Okay. Do I need to assess his airway and breathing? Hey, are you having trouble breathing? The patient is saying no. Okay. Assess his circulation. I'm going to control major bleeding. Okay. I'm going to get whatever it says in the chapter that is the protocol for controlling bleeding. Okay, I'm going to go ahead and do that as quick as possible. I'm going to assess his pulse. Okay. I feel that he has a pulse of 88 BPM. Okay. His skin, as for his skin signs, his skin is warm and dry. So that's normal, but we're going to move on. Initiates shock management, positions patient properly, conserves body heat. All right, cool. Identifies patient priority and makes treatment transport decision. We're going to go ahead and do that after we determine his GCS score. Okay. So, hold on for a second, y'all. I'm going to go ahead and get this out. I'm sorry. In theory, this would not be what happens on the scene. Eye-opening. Okay. Does he open his eyes to any thing that I do? Okay. Yes. So 4. He gets a 4 for eye-opening. For verbal response, again, I'm gonna go ahead and make sure he is verbal. Yes, he is. He gets a 5. He's oriented. Okay. Motor response. He's localizing his pain. He's localizing the pain in his head. He just fell and hit his head. Okay, so he gets a 4. All right, so we get a 4 or 5. A 4 or 5 5. I'm sorry. Okay, that's his GCS score. We're gonna go ahead and have to transport him soon. I mean, he has a laceration to his head. I'm gonna go ahead and do history taking. Do baseline vital signs. Well, before that, I'm going to ask him, okay, do you have any past medical history with, do you fall down usually? Do you, take these medications? Do you take anything that makes you dizzy? Do you have any allergies to any certain medications? Patient is saying no to all those. All right, cool. Let's go ahead and take his vitals. Okay, hold on. Just a second. Alright, I'm going to go ahead and take his vitals. I'm going to put this around his arm. Okay. I'm going to go ahead and get this on. Okay. Make sure this is working. Okay, cool, it's working. I'm going to get it. Okay. Is it okay if I take your blood pressure? Alright. You want to use your right arm? Okay, let's go ahead and, can you go ahead and take your right arm and put it like that for me? Okay, cool. I'm gonna go ahead and put it on his brachial. Okay. Then I'm going to make sure that this is viewable, and then I'm gonna go ahead and get the pump, make sure it is all the way to the right, and then I'm gonna go ahead and pump it to 200. Okay, then I'm gonna release it as slow as possible. Okay, I can hear his pulse. His blood pressure is, okay, 142 for the systolic, and then, okay, around 86 for the diastolic. Okay. Okay, let's put that back really quick. Is it okay if I take your pulse? Okay. Boom. His pulse is around 88 BPM. Alright, is it okay if I take your, again, his skin signs? Skin is looking normal, he's warm and dry. Is it okay if I take your eye signs? Okay. Boom. Boom. Alright. His eyes are pearl? Okay. Now I'm going to go ahead and move on. For sample history, his symptoms are, he has a headache, he has dizziness, he has nausea, and right arm pain. Okay. Do you have any allergies? No, he has no allergies. Do you take any medications? Well, he has a history of high blood pressures and anxiety, so he takes propranolol and metoprolol. Okay. And a daily multivitamin. All right, sounds good. Do you have any past medical history? He has hypertension and a previous wrist fracture 5 years ago. Ooh. Okay. What's your last oral intake? Patient is saying he had lunch around 1 hour ago. Okay. As for the events leading up to the incident, he was walking up to the refrigerator when he slipped on a wet spot on the floor. All right. Thank you. Now I've taken the sample history. I'm gonna go ahead and do a secondary assessment. I'm gonna assess his head some. Okay, his head is tender. He has a laceration, so I'm gonna go ahead and be careful, and I'm gonna go ahead and be as quick as possible. Okay, feeling on, is the neck, the skull a little bit, parietal bone a little bit. Okay, cool. I'm gonna go ahead and assess the chest. Okay, I'm gonna inspect your chest a little bit. Is that okay with you? Cool. Palpitate chest. Okay. Then his pelvis. All right. Cool. Moving on, and then upper and lower extremities. Cool. Upper, his arm. He has pain in his right arm, so I'm gonna be careful. All right. He's screaming a little bit. Okay. Then I'm gonna do his lower extremities, his legs. Cool. Posterior thorax, lumbar, and buttocks. All right. I'm gonna go ahead and quickly assess that if I need to. All right. Cool. Flipping back over. Manage the secondary injuries and wounds appropriately. I'm gonna go ahead and manage these injuries and wounds appropriately as it says in the book. Again, I haven't seen the trauma chapter. I'm not sure if we went over that just yet. As for the reassessment, it demonstrates how and when to reassess the patient. Okay, I'm going to reassess you, take your pulse again. Are you doing okay? Are you feeling good? We're going to go ahead and transport you as quick as possible. Then I'm going to give a verbal report to additional EMS. All right, cool. And give whatever I had written down to this additional unit. Okay. Thank you.